Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from the Team Needham Abode podcast studio. And I'm super excited to have Dr. C.G. Bronson on our podcast today to be discussing testosterone versus other anabolic substances that are abused in the gym culture. This is a big pet peeve of mine and something that's going on. And it seems like younger and younger men and women are getting involved in some of these anabolic substances, and they're not like testosterone. And so, Dr. Bronson, welcome to our show.
Thanks for having me. I appreciate it.
So I think I found you on TikTok the first time. I follow you on TikTok and on Instagram.
Mm.
And just tell us a little bit about your background and your history and why why you talk about testosterone regularly.
Well, I'm a board certified internist, so I did my training at Mizzou, University of Missouri, but I'm originally from Illinois. And yeah, I've had an interest in androgens and testosterone since I was in med school. So when I finished residency training, I was doing what's called traditional practice, meaning I was still working in the hospital, but also the clinic. And I also had a TRT business, or what we would say longevity or metabolic health clinic, which is a telehealth clinic on the side, which is what I do full time, and have done a lot of my self research in. And yeah, it's pretty much exclusively what I see patients for right now is anti-aging care and more advanced, innovative. What we call it, innovative and preventative medicine. We don't call it anti-aging medicine. Call it innovative and preventative because it's preventative of chronic diseases, which are very common these days.
Right. Mostly caused by lifestyle. So my
Yep.
wife and I, we specialize. We own a pharmacy. We're both pharmacists, and we specialize in hormone replacement. So we do a lot of testosterone for men and for women. And so tell us some of the benefits of testosterone for men and women.
Well, for men, it kind of depends if you're what's called hypogonadal or not. If you're hypogonadal, it means you have very low testosterone levels compared to the normal population, in which case supplemental testosterone can improve your metabolism, which is another way of saying it can improve your body composition. So as we age, we lose skeletal muscle, so we lose our muscle mass, and we gain a lot of fat around our internal organs called visceral fat. And one thing that TRT does, which is fairly unique, there are very few drugs that do it, is it reduces visceral fat
Mhm.
and increases your skeletal muscle mass. And in so doing, most of your blood sugar or glucose is metabolized within your skeletal muscle. So you gain muscle, you lose fat. It makes your metabolism faster, for lack of a better way of explaining it. Um, those are the benefits in men. Even men who don't have low testosterone levels still get body recomposition benefits and other metabolic benefits. That's actually what my clinic specializes in, is the use of testosterone as an adjunct treatment for what's called metabolic syndrome, which is obesity that has reached the stage of like chronic low grade inflammation. So um, that's what we use it a lot for. But the classic indication is just you have low testosterone levels, in which case there's lots of benefits to using testosterone. But even if you don't have low levels and you have metabolic disease, testosterone in many cases can still be beneficial. In terms of women, the main benefit of testosterone, there's really two. Number one is it does improve sexual function, especially in late perimenopausal and postmenopausal women. Um, so there's something called female hypoactive sexual desire disorder. We call it something different now in the DSM-5, which is the manual of mental health disorders. Um, it's basically hypoactive sexual desire disorder in females, and that's what testosterone's primary use is. It's also used in women who are going through menopause and have when you go through menopause, you have thinning of the vaginal epithelium and other changes in the genitourinary system, which can be helped by testosterone as well. So those are the two main reasons to use it in women. But men, the use is obviously a lot more wide and inclusive. Some people, healthcare providers, will use testosterone in women, even just as a standard anti-aging thing, which is very controversial. A lot of women do like their testosterone, though, especially like compounded forms of testosterone, compounded creams. Yeah, that's pretty much it. I actually forgot the original question. I ramble so much that I forget sometimes.
That's all right. That's all right. I get it. I do too. I have such a
Yeah.
passion for hormones. I ramble. But let's not forget about bone density. There's not a better drug, in my opinion, to help for bone density for women and for men, that matter,
Yeah.
than
Yeah, that's
testosterone.
true. So that is true. So testosterone does improve bone mineral density in both men and women. Unfortunately for men, the studies so far haven't really shown that the fact that testosterone increases your cortical bone density results in less fractures as you age. In fact, there's even some evidence that patients on TRT have an increased risk of things like hip fractures and maybe even ligament injuries and stuff. That may just simply be because men on TRT are a lot more active than men who are not on TRT. That makes sense, right? So they actually
Yeah.
have the energy to exercise. And so that may be part or all of the explanation. But yeah, for women, definitely testosterone does improve bone density. I mean, it improves it in men and women. It's just a matter of translating it into important, clinical outcomes. Because I could say, your bone density is very high, and you'd be like, okay, cool, but what does that actually mean? Well, when you become very elderly, when you get a hip fracture or you sustain what's called a fragility fracture, your risk of dying early is very, very high.
Yeah.
So actually, that's why bone density is so important in men and women, because it's what's called a surrogate measure for your risk of life-shortening complications due to gravity, like you know, um, ground level falls that break your hip or like break your arm or whatever. So yeah, that's what the research shows. I think that if they used higher doses in men when they looked at bone density, they would have found a more beneficial effect. But right now, that's all the evidence we have is definitely testosterone has beneficial effects on body composition that translate into beneficial like metabolic outcomes. In other words, patients that are started on TRT with what's called pre-diabetes, so they have high fasting blood sugar, but not at the level of diabetes. They tend to have a much lower risk of progressing to type 2 diabetes than, say, people who are not on testosterone. And that's even in men who have so-called normal testosterone levels, too, by the way. So
Yeah.
testosterone's very complicated. Most people, when they hear it, they think it's, it's a treatment for low testosterone levels, but that's not, strictly speaking, true. It's mostly true, but it's not completely true.
So let's talk about the difference between, we hear about steroids in the gym culture, and I don't even like using that term because it's such a broad term, as you know. And let's talk about, steroids and the or testosterone and what the difference is about some of the drugs that bodybuilders and power lifters abuse in the gym. How are they different? Because we do know that testosterone helps for overall health in general, and a lot of those drugs that are abused by bodybuilders and power lifters actually shortens their lifespan. So can you talk about that?
Yes. Yeah, sure I can. Let's start with the first thing is that anabolic steroids, testosterone's an anabolic steroid. Okay. A steroid is just a way of describing how a molecule is chemically structured. Okay. So it's a sterol. So testosterone is one of them. As far as abuse, though, like bodybuilders or athletes illicitly abusing substances for performance reasons, a lot of times they will use testosterone. So that could be a way of, if you're a competitive athlete, that's, I guess, a way of cheating. Or, bodybuilders, it's just standard that at the professional level, they all use steroids. So it's not really cheating in the same sense. But testosterone is very different than so-called anabolic steroid abuse, in that it's, it's a substance that your body makes naturally, and that actually declines naturally with age. And there's a lot of robust evidence that supplementing testosterone can have a lot of benefits. There's no such evidence for chemically similar substances which are abused for muscle aesthetics or performance enhancement in a lot of ways. Number one, anabolic steroids other than testosterone are very toxic. They cause, even testosterone at high doses can do this, outside of medical supervision as well. But and by the way, patients who use testosterone for like bodybuilding purposes use like 5 to 6 times the medical dose. So it's not the same thing in that sense either. But it's different in that the other synthetic androgens are very toxic. A lot of them have alien metabolites that humans are never supposed to have circulating in their bloodstream. They cause cardiomyopathy. They cause what's called endothelial damage, so they can mess with your blood pressure and really the ability of your blood vessels to relax and dilate, something called flow mediated dilation. So by impairing, how your blood vessels relax and dilate, they actually increase your risk for sudden cardiac death, for cardiac arrhythmias, meaning abnormal heart rhythms, and definitely increase your risk for enlarging your heart and developing something called heart failure. We know that from the best studies that have been done, patients who use 500 milligrams or roughly equivalent, or very high doses of synthetic androgens for at least 5 years, something like 15% of them develop heart failure with reduced ejection fraction. And about 50% of them develop abnormal ejection fraction, but with not quite at the level of decompensated heart failure. So long-term use, even at moderate doses of synthetic androgens other than testosterone, is as you said, life-shortening. It's nothing like TRT, and it's very bad for you. I do treat a lot of professional bodybuilders, by the way, so that's kind of my background as well. And we do a lot of like cardiac monitoring, so I don't obviously prescribe any illegal drugs to them, but yeah, that's really my background is testosterone and non-medical use of synthetic androgens, and they're really not the same really in anything other than just strictly the category. Like testosterone's an anabolic steroid, sure. Technically, yes, it is, but especially if it's being medically supervised, it doesn't carry. Sorry for the kid yelling out. It's not my kid, so I can't shut him up. But you know what I mean. That's really that's really the big difference. Is one is to treat a medical condition, and that medical condition can either be what's called hypogonadism, meaning you have very low testosterone levels, or it can be an adjunct treatment for metabolic syndrome, which means you have a lot of central obesity. You're obese, but most of your weight is carried in your abdomen. So you have inflammatory obesity, the type of obesity that increases your risk for just about every chronic disease you can think of, and most types of cancers actually too. So that's the benefit of TRT, is that it can reduce visceral fat and reduce your risk of chronic disease. But the same cannot be said of aesthetic doses of non-testosterone androgens.
I'm just surprised to see, and I don't know what your experience is, but I'm just surprised to see in the gym culture how younger men and women are abusing these substances. I mean, there are young teenagers, less than 18 years old, that are using this stuff now, and it's to
Yeah.
me, Dr. Bronson, it is just scary and sad. I just want to get the word out there that it's dangerous.
Yeah, so the use of anabolic steroids by young people is exploding in the Western world, in the United States too. Well, as part of the Western world, but especially in the United States. And yeah, it is very concerning. But why the popularity of the drugs is surging, I couldn't really say. I mean, this is like where you get into social psychology. I think a lot of young men are more concerned today about their physical appearance and their aesthetics. And so maybe that plays a little bit of a role in why steroid use is exploding. Um, because for instance, we know that illicit steroid use amongst young people, including like high school athletes, is more common today than it was even in the height of the steroid scandal in the 90s. Like if you remember that,
Hmm.
when the baseball scandal was around. So there's a lot of young men that are sitting on really massively catastrophic future chronic health issues. And it's a problem for which I think mainstream medicine isn't quite prepared, because we haven't really given um, men who abuse androgens very good care in the past. And so I think we're going to see the consequences of that in the next few years for sure. And I already have seen them personally. So it is just one of those problems that epidemiologically is becoming considerably worse. But people shouldn't confuse medical testosterone therapy with anabolic steroid abuse. I mean, it's really there's almost no similarities between the two, except for the fact that testosterone is technically an anabolic steroid, but that's pretty much where the similarities end.
I agree. So, what are some of the long-term health consequences that you've seen with people that have abused these anabolic steroids?
Oh, I've seen them die. Sudden cardiac death.
Wow.
That's happened. We've seen that. We've seen just very severe heart failure. Very difficult to control hypertension. The problem with synthetic androgens is if they do cause endothelial and myocardial dysfunction, there's no guarantee that just stopping the agents will completely reverse the damage, which is a very, very popular misconception, because there was a study called the Harlem study, which was done 20 years ago, which showed that most of the echocardiographic evidence of myocardial damage was reversed simply with cessation. But number one, they didn't have the echoes that we have today. Like we can measure using tissue Doppler and other advanced ultrasound, things. We can really get insight into how the heart is functioning before you develop what's called decreased ejection fraction. So with each beat, your heart is supposed to pump out something like 50 to 70% of your blood volume. That's a rough number. That's not exactly accurate, but it's somewhere around that. Um, and patients who abuse steroids, like I said, something like 40 to 50% of them after 5 years develop decreased left ventricular ejection fraction. And it's not clear that in the majority of these cases that is reversible with simply just stopping the drugs. In fact, it looks like in most cases, once you develop that, it does not reverse.
And are
That's
you
the
seeing
evidence
this?
right now.
Wow, that's scary. Are you seeing this in was there an age? Was this in 20-year-olds, 30-year-olds, 40-year-olds? Did it matter?
I've seen it in all ages. The thing is that androgens have pleiotropic effects. They affect people very differently, and there's a lot of there's a lot of individual variability in how your genetics are set up and how and what's called how much oxidative stress you can tolerate in your heart and blood vessels. Some guys can tolerate quite a bit. These are the people that have been pro bodybuilders for decades, and maybe they're retired just on a TRT dose. If you do an echocardiogram on them, you may not find too much that's abnormal. Usually they have some kind of left ventricular thickness, which may be a result of the androgens, but also you get that with exercise too. Problem is, a lot of guys do develop serious medical complications, and they don't realize just, you roll the dice every time you take the androgens, because we don't have, for example, good studies that say, oh, this type of person will definitely have problems, or this type of person is probably unlikely to have problems. I mean, I've seen guys who are 24 years old who have used steroids for 3 years that have almost 100% occlusions of their left anterior of their proximal LAD. That's called a widowmaker, because those are the types of heart attacks that kill people. Yes, early 20s, we've seen that. Contrary wise, I've seen guys in their 50s, 60s that have been doing this, and they see me because I'm the best and I know more about this stuff than any other. Most other. I don't want to say any, because there's always someone that knows more than you out there. If you want to leave a little bit of room, but I do see a lot of 60-year-olds that they've tolerated it well, but it's impossible to tell the difference up front between who's going to be who. You know what I mean?
Well, I think it might be a dosing issue too. I mean, if you look at what's happened with bodybuilding over the last 20 years, is that the guys have, like at the Mr. Olympia level, the guys have gotten bigger and bigger, and partly it's because they're just using more and more of the stuff. I mean,
Yep.
In bodybuilding, if one is good, then 20 is better. And so it's all about being as big as they can. And I think that's part, Dr. Bronson, is what these young men are looking at. So they see these guys on social media and they want to look like them. And I just want to get this out there that those guys are not healthy. I mean, they are ticking time bombs. And you talk about people tolerating drugs. If you look at bodybuilding let's just go back to Arnold Schwarzenegger. They didn't have all the fancy compounds back then, but they did have TRT and maybe a little bit of growth hormone. Arnold was, I think, a 7-time champion. And then after him, it was Lee Haney and Dorian Yates and Ronnie Coleman dominated. Now, there's not a bodybuilder that can go for 3 or 4 years and dominate anymore. And it's partly because they can't tolerate the drugs.
Yeah. No, you're 100% right about that, actually. And that there's also some evidence that, like, the amount and the doses of drugs that young people are using when they abuse the drugs is getting higher, so more extreme. So you're right about that. Yeah. And a lot of them can't stay at the top for long periods of time, because it does become a contest as who can poison themselves the most, right? So that's definitely part of it, and that is definitely true. But for some reason, even some people can tolerate very high doses of synthetic androgens for very long with almost minimal effect. Some people barely, like I told you about that 24-year-old kid with the widowmaker. That kid was gonna die. Like, if we didn't do that CTA on him, there's a very good chance he would have just died.
Wow.
He would have just been in class or at work or whatever and just dropped dead. And there's a lot of misinformation online on social media, especially that the steroids are safe, and it's total bullshit. I mean, this crazy stuff I've seen, and excuse me, I don't know if I'm allowed to curse on here.
You're fine. Yep.
Apologize. I mean, they do tremendous damage, and it's unfortunate because there is a lot of really bad misinformation. But but there's also misinformation in the sense that there's a lot of, like, older middle-aged guys who are obese and have chronic diseases that could benefit from TRT, but they hear all this steroid stuff, and they think that it has anything to do with them, and it has nothing to do with them.
Right.
So
And that's why I wanted to put this out there, because they're not the same.
right.
So what causes because a lot of times there's kidney problems. Is it the endothelial damage or the hypertension that causes the kidney problems? What causes the kidney problems?
Well, what causes the kidney problems is we don't know. I mean, androgens in men and women have what's called sexually dimorphic effects. So, for example, in men, testosterone and other androgens enlarges the proximal convoluted tubule, which is the first part of the nephron that filters your urine. So, for people who don't know, your kidney's job is to filter your blood of toxins. That's what you excrete in your urine as things that are not good to keep in your bloodstream. So androgens affect the kidneys in a variety of ways. They can affect how much pressure is what's called your glomerular filtration rate, which affects your creatinine on your blood test, how fast you clear substances out of your bloodstream. But it can also affect your mitochondria in your cardiovascular system and in your endothelium. So it causes oxidative stress. Testosterone and other androgens cause your mitochondria to increase their energy production. So mitochondria are little organelles in cells. They're in just about every cell type in the body. They're not in red blood cells, but they're in like heart muscle cells, they're in endothelial cells, they're in smooth muscle cells that line your blood vessels, all the things, okay? And androgens, by increasing how fast, I don't know if the fast is not like the technically correct term, but it's kind of like an engine, okay? Like if you have an old car engine that you rev to full power, whatever, like the engine may not tolerate it well, right?
Yeah.
So it may get hot, it may produce sparks. That's why you have spark shields, but in bad cases, it may, ignite fuel lines, and burn things, right? So I'm not a mechanic, so obviously I'm not explaining it as well as I should, but that's the idea, is that your mitochondria, where most of your energy is made, testosterone increases the activity of those organelles. And as a result, those organelles, which you can think of as engines, they produce more sparks. The biological term for that is free radicals,
Mm-hmm.
or what are called reactive oxygen species. And if that happens in heart muscle cells, for example, okay, too much of that causes damage to the cell, because free radicals basically they damage the cell, and when you have too much damage, your body just destroys the cell and replaces it with scar tissue, what's called fibrosis. If that happens in heart muscle, that's really that's really really bad, because your heart is designed to propagate electricity in a very coordinated fashion. And if you have a lot of scar tissue that forms in the cardiomyocytes that's adjacent and together, you can interfere with the electrical conduction, and that can predispose you to sudden cardiac death. That can predispose you to heart failure. And that's not to mention all the things that it does to your blood vessels. It's the same thing. It causes oxidative stress in your blood vessels. It causes them to misfunction. Misfunction is not a word. Causes them to become dysfunctional.
Yeah.
And that leads to, all kinds of consequences, like very high blood pressure, which having high blood pressure then is what really causes the kidney damage, okay? Because it increases the pressure, the filtration pressure in your kidneys. So that's really all the different ways that steroids, I mean, that's not the only way. I mean, there are also brain effects. The thing with a lot of synthetic androgens is these are drugs from the 70s and 60s, okay? When the pharmaceutical companies were developing them, they were developing them with the idea that, okay, we need to replace testosterone. Because, for example, in the 1950s and 40s, women with end stage renal disease got testosterone propionate as a treatment for their end stage kidney disease. Why? Because end stage kidney disease causes your red blood cells to drop precipitously. There's a complex reason for that. I won't go into explaining that, but though women in the 1950s got TRP, testosterone propionate, and it caused masculinizing effects. So it deepened their voice, facial hair growth. It caused a lot of like unwanted negative side effects. So the synthetic androgens were designed in part to reduce the side effects of testosterone in women, but also in like children and little girls and things like that. And largely the drugs failed because they were just so unsafe. They could never, they see, the thing is that even with, you've heard of SARMs, selective androgen receptor modulators, which are not steroids, but they act like androgens, okay? They could never really isolate and find substances that worked as well as testosterone, but with less toxicity. Testosterone has side effects, causes you to retain water. I mean, can cause transient moodiness. It has side effects like every drug, right? They could never find anything that was better than testosterone. They really couldn't. They could find stuff that was less masculinizing, that women could tolerate better. But what eventually happened is, like in the 80s, they discovered erythropoietin, which is the hormone in the kidneys that controls red blood cell production. So they started giving women with chronic kidney disease erythropoietin, because then, they avoided all the masculinizing effects. But the thing people need to realize, and I guess the whole point of why I'm going into this, is anabolic steroids, not testosterone, but other synthetic androgens, are mostly just failed drugs. There's a reason why they're not used commonly, because they're very toxic. That's the main reason. And if you're a young person, by the way, if I'm a doctor, I could give you a prescription, and you could take that prescription to whatever equipment you have in your compounding pharmacy. I'm sure it's all sterile and safe and whatever. These guys getting this shit online don't get that kind of quality.
Exactly. I mean, and that's what Dr. Bronson, when I see a gym rat or a meathead on TikTok or whatever social media, educating people about trend and D-ball and all this stuff, it just wants to make me throw up. It's like, why would somebody trust a meathead in the locker room of a gym to sell them stuff? And it really, the culture is just, it really infuriates me. And that's why I wanted to do this podcast. So what about liver toxicity? Is it because the liver's trying to detox from all these toxins? Is that why they're liver toxic?
Some, especially oral steroids, undergo extensive first pass metabolism. So they're extensively metabolized in the liver. And like I was saying, the kidney's job is to detoxify your bloodstream. The liver also plays a very big detoxification role as well. And so the way a lot of steroids are designed is they don't become bioactive until they're conjugated or they're chemically manipulated in the liver. In the process of that, you can damage the liver cells, again, through oxidative stress or mitochondrial damage. The good thing is the liver can regenerate itself a lot better than other tissues, but like the liver regenerates itself much better than, for example, heart muscle or blood vessels. But yes, it is a very serious problem, and but I'm again, because I ramble, I forgot the original question. You said about the liver.
Liver toxicity.
Yeah, the liver toxicity is just the way some of the drugs are structured, as it gets metabolized in the liver to its active ingredient, so to speak. But one very common misconception about that is, for example, there are a lot of, and you probably know this being in the pharmacy business, there are a lot of compounding pharmacies that will, for example, we'll make some compounded Anavar for you, right? We'll make it in a troche that gets dissolved under the tongue, and maybe it doesn't get metabolized in the liver, so therefore it's safer. Well, again, as we were already talking about, the real danger from synthetic androgens doesn't come from the like liver toxicity. I mean, that's obviously a big concern. Have I seen liver damage in steroid users? Of course I have. But the biggest concern is the damage that it does to your heart and vascular system.
I mean,
and there are a lot of reasons why it would do that, which are very complicated, and a lot of it is speculative too. But yeah, I don't know how deeply you want to get into that.
Well, I like what you said about they were failed drugs to try to copy testosterone. And let's face it, testosterone is natural to our bodies. We should know that, there's probably not a better thing that we can do as humans to create something better,
Right.
without side effects. And that's why, as a pharmacist, I'm a big believer in that if it's not natural to our bodies, we probably shouldn't put it in our bodies. And that goes for most all drugs. I mean, I'm a pharmacist that doesn't believe in drugs to treat most chronic disease, just for that reason, because they are poisons. Whereas testosterone is natural to our bodies. Now, not to say that if we abuse it and use super physiological doses that we can't have side effects, but you know. And then I want you to go into lipids. What does these synthetic anabolics, what does that do to the lipids? I've heard that it flips our lipids and triglycerides super high, HDL low. Is that correct?
Well, it does lower HDL. All androgens, even testosterone, can lower your so-called good cholesterol, your high-density lipoproteins. The significance of that for cardiovascular disease is fairly minimal. What's more important is your LDL cholesterol, your what called bad cholesterol, low-density lipoprotein. But either way, even the effect on good cholesterol, if you're just talking about TRT doses of testosterone, a lot of studies actually your bad cholesterol actually improves over time because the testosterone, helps with your body composition and especially reduces the fat around your internal organs. And in so doing that actually makes your bad cholesterol better. And then after about a year or so of treatment, your so-called good cholesterol is pretty much back normal. Just testosterone by itself doesn't hugely lower your so-called good cholesterol, but what's more important is the so-called bad cholesterol. And like I said, over time, testosterone can improve that. Now, the other synthetic androgens, it depends on the exact agent you're talking about, and people that use that are usually very, very low body fat, and the lipids don't quite kill that. I mean, what other synthetic androgens do more so than affecting your lipid numbers is they interfere with how the cholesterol works or how it transits and through the bloodstream, and maybe makes it more likely to deposit in the walls of arteries and things like that. And so that can be the real problem, if that makes sense.
Yeah, it sure does.
Yeah, so even if it doesn't affect the numbers, it still affects the function in a negative way, if that makes sense.
And that's the important part. So
Yeah.
Well, yeah,
And
you've
for
helped us. You've really helped educate me, and you've helped educate our listeners and viewers, Dr. Bronson. And as we wrap this podcast up, tell us what you have a passion for.
Well, I still have a passion for testosterone. I'm on my way to Guatemala, so I guess I'd also have a passion for Latin America, or maybe Latinas. I don't know, one or the other. So yeah, that's what my big passion. I have 2 kids. I spend time with them. My son's big into hockey, so I guess I'm big into hockey. But those are my really my main interests, and I work all the time, really. You know, probably like you, running a pharmacy is probably a 24/7, or almost seems like a 24/7 job. Running a clinic isn't, I guess, too much different. Um, takes a lot of work to be productive and successful these days.
Hey, that's why we're created, is to be productive. So,
Right.
so if anybody has any questions, Dr. Bronson, what's the best way to find you?
So my main website is b3, the number 3clinic.com. That's probably the best way to reach me, is through the website. I'm also on
Awesome.
TikTok, Instagram. Instagram is cbronsmd, CBRONSMD, and then like YouTube and TikTok is cbronsonmd. So I'd
Awesome.
be happy to see you guys.
Well, I appreciate you being
Yeah,
on our podcast today and help us.
Sorry for getting you right as I get on a plane.
No, I got it. So you've helped
Yeah.
us realize our goal, which is to educate and empower individuals to take charge of their own health. So thank you so much, Dr.
Yeah,
Bronson.
I appreciate you guys. I like your show, and appreciate you.
All right, sounds
All right.
good. Let's
We'll
keep in
see
touch.
you.
All right,
Thanks.
bye-bye. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Wednesday to our midweek podcast, where We stream 8 a.m. to 9 a.m. Pacific Standard Time. Thank you for listening and watching.